Hello, everyone. My name is Danny Weston, and this evening I will be discussing with everybody the stigma on mental health as well as what is mental health. So, to start off with, I would like to just quote from a site from the Mayo Foundations for Medical Education and Research from 1998 to 2019. They were saying that mental illness can be a variety of disorders that affect your mood, thinking, and behavior. And for examples, this can come from either mental illness with depression, schizophrenia, anxiety disorders, eating disorders, or addictive behaviors. And then, with that being said, another source is saying the England's Mental Health Foundations of 2019, 450 million people worldwide have a mental health problem. And people are all around us, and you would never know that somebody had a mental disorder. So if you can't tell the difference, why treat somebody different when you know they have a mental health disorder? So moving on from this to go over a few questions and answers and discuss basically what mental health is. A few questions is people with mental health problems, why are they running out of so many resources? And then a majority of the population with mental health disorders, why are they not seeking treatment or seeking treatment later than sooner? So, and then we'll also discuss a few treatments dealing with mental health. So basically, with mental health, a lot of patients are not, being able to reach out for different resources due to lack of funds. As an example, Dorothy Dix Hospital, which is a psychiatric hospital up in Raleigh, it closed its doors back in 2012, and this was a huge deal with the mental health resources in the Triangle area. Patients used Dorothy Dix Hospital as a main resource. It was an inpatient hospital. It had several outpatient clinics. Now, with closing, as well as other mental health facilities years later, this is putting a huge burden on emergency rooms in your local hospitals due to so many mental patients are coming in for mental health evaluations or treatments, and it's causing a delay and a backup in the wait time for other patients who are coming in with, sicknesses, injuries, certain things like that. Now, if we would quit closing doors and quit pulling funds from the mental health developments and projects and certain facilities, these certain things wouldn't happen. Now, like I was saying, mental health patients are just like everybody else. We wouldn't treat our cancer patients or our diabetic patients any different than we would treat somebody with any other disorder. So what is the big deal with treating mental health patients with a certain stigma? A lot of people don't understand mental health very well. They think, some people may even think that that mental health or mental illnesses are contagious. That's not true. Mental illnesses are not contagious. Mental health patients or citizens are just like you and me. They have a mental disorder other than a physical disorder. And both mental and physical disorders can be treated with therapy or medications. Now, with this being said, a few things with why are mental health patients being pushed aside. This has a lot to do, like I said, with lack of funds. Now, we need to start helping with our mental health facilities and either donating or volunteering, because due to such lack of funds, people that are working in the mental health facilities are subsided to taking lower paying jobs due to the lack of funds, people not wanting to work with mental health patients because, like I said, the stigma, they are, afraid of mental health patients, which just shouldn't be a problem. People need to be more educated on mental health as a whole. Now, with treatments of mental health disorders, there is, like I said, medications with antidepressants, medications for your anxiety, your depression. There are also state hospitals that can take you in as inpatient or outpatient to discuss counseling, certain medications, therapies. And then, there is electroshock therapy, which is different from back in the day. Nowadays, with electroshock therapy, they actually put you to sleep and give you a muscle relaxant so you don't feel a thing. You wake up and the treatment has helped with your mental disorder. Now, a couple of things also discussing with mental health illnesses. as patients, and people should be treated just like us. There is no difference, like I said. So we should, reach out, help our mental health patients like we do every other patient or citizen. Be there for them. If your friend or family member has a disorder, don't push them aside or treat them any different. Always be there for them. They are caring people just like we are. They have feelings. So with that being said, I would like to thank everybody for taking the time and listening to this speech, as well as listening to me discuss a few things about mental health. If you have any questions, please contact me or send me a comment, and I'll be happy to explain a couple of things to you. And like I said, if you have a family member or a friend that has mental illness, be there for them. They may be scared, not knowing what to do. Just try to help them find resources and what fits them best, and try not to have, a stigma towards mental health, and just watch out for others that do, and just try to educate them on how to act. Like I said, thank you for watching, and have a good evening and a great summer.